Colon cancer warning signs 1 month before it happens. Detect it quickly. Welcome to today's video about the warning signs of colon cancer 1 month before they manifest. You've certainly heard of colon cancer, right? Have you ever wondered if your body can give any signs a month or a few months before you have colon cancer? If you experience any of these signs that I'm going to tell you about in this video, you should seek medical attention immediately because they could be signs that colon cancer is about to develop. These warning signs might manifest as early as 1 month prior to a colon cancer diagnosis. Okay, now let's dive in. Persistent unexplained changes in bowel habits. Changes in your bowel habits, like diarrhea or constipation that last for more than a few days, can be easy to dismiss. However, understanding their significance and acting upon them promptly can have a profound impact on your health, particularly when it comes to battling diseases like colon cancer. These changes are your body's way of signaling that all is not well. Colon cancer can cause these changes by affecting the way your colon works. A tumor in the colon can create blockages or alter the normal function of the digestive system, leading to unusual bowel movements. For instance, you might experience diarrhea because the tumor partially blocks the passage of stool, causing liquid stool to pass around it. On the other hand, constipation might occur if the tumor creates a complete blockage, making it difficult for stool to pass. According to a study published in Gastroenterology, individuals with chronic constipation have a 1.78 times higher risk of developing colorectal cancer compared to those without constipation. Early detection of these symptoms greatly enhances the effectiveness of treatment and can significantly improve survival rates. By identifying these changes early, doctors can tailor a treatment plan that is both effective and manageable. This might involve various diagnostic tests such as colonoscopy, which allows doctors to visually inspect the inside of the colon and detect any abnormal growths or changes. Also, being aware of these changes can make a huge difference in how well someone responds to cancer treatment. For example, persistent diarrhea can lead to dehydration and nutrient loss, which can weaken your body and make it harder to withstand cancer treatments like chemotherapy. Constipation, on the other hand, can cause discomfort and additional complications if not addressed promptly. It can lead to a buildup of stool, which might result in severe pain and even bowel obstruction, a potentially life-threatening condition. Blood in stool. Seeing blood in your stool, whether it's bright red or darker, is a sign that something might be wrong. While it can be caused by less serious issues like hemorrhoids, it can also be a sign of colon cancer. According to a study in the American Journal of Gastroenterology, the prevalence of colorectal cancer in patients presenting with rectal bleeding is approximately 11%. This symptom shouldn't be ignored, especially if it happens repeatedly or is accompanied by other symptoms like pain or weight loss. Colon cancer can cause bleeding in the digestive tract, which can lead to blood in the stool. This bleeding might appear as bright red streaks on the stool or darker, tarry stools, indicating that the blood has come from higher up in the digestive tract. Early detection of this symptom can lead to a quicker diagnosis and a more effective treatment plan. Seeing a doctor early can help identify the cause of the bleeding and get you the right help. Your doctor might conduct tests such as a fecal occult blood test, FOBT, to detect hidden blood in the stool, or a colonoscopy to visually examine the inside of your colon and rectum. Recognizing and addressing this symptom promptly can significantly improve the chances of successful treatment if it is indeed a sign of colon cancer. In addition to colon cancer, blood in the stool can also indicate other conditions such as gastrointestinal infections, inflammatory bowel disease, IBD, or diverticulosis. Regardless of the cause, it's essential to seek medical advice to determine the exact reason for the bleeding and to receive appropriate care. If you found this video helpful so far, please like the video and subscribe to our channel so this information can reach more people. Unexplained weight loss. Unexplained weight loss can often slip under the radar, especially if it happens gradually. However, understanding its significance and acting upon it promptly can have a profound impact on one's health journey, particularly when it comes to battling diseases like colon cancer. This kind of weight loss is your body's way of signaling that all is not well. According to an article in Cancer Epidemiology, Biomarkers and Prevention, unintentional weight loss occurs in approximately 40% of patients diagnosed with colorectal cancer. Colon cancer cells can demand a significant amount of your body's energy supply, leading to weight loss. These cells consume a large amount of energy, depriving the rest of your body of the nutrients it needs to maintain a healthy weight. Additionally, colon cancer can cause changes in metabolism, making it harder for your body to absorb nutrients from food. One of the pivotal reasons to take sudden weight loss seriously is its potential to flag cancer before other symptoms appear. Weight loss that occurs without a change in diet or exercise routines is particularly concerning. When coupled with other symptoms such as changes in bowel habits, blood in stool, or persistent abdominal pain, it becomes even more critical to seek medical advice. The combination of these symptoms can provide valuable clues for early diagnosis. If you experience unexplained weight loss, don't ignore it. Keep track of any other accompanying symptoms and discuss them with your healthcare provider. This proactive approach can lead to earlier detection and treatment of colon cancer or other serious health conditions, ultimately improving your prognosis and quality of life. Persistent abdominal discomfort. Persistent abdominal discomfort, including cramps, gas, or pain, can be a sign that something isn't right in your digestive system. While it's common to experience occasional stomach discomfort, if it becomes a regular occurrence, it's important to pay attention. Colon cancer can cause abdominal discomfort by creating blockages or affecting how your intestines function. Tumors in the colon can obstruct the passage of stool and gas, leading to pain and discomfort. This discomfort might be localized to a specific area of the abdomen or can be more generalized. You might also experience a sensation of bloating or fullness that doesn't go away. If this discomfort doesn't go away, it's essential to seek medical advice to determine the cause and get appropriate treatment. According to a study in the Lancet Oncology, about 20% of patients diagnosed with colorectal cancer reported persistent abdominal pain or discomfort as a symptom. Persistent abdominal pain can be one of the early warning signs of colon cancer, and addressing it early can lead to a quicker diagnosis and better treatment outcomes. Ignoring persistent abdominal discomfort can allow potential problems to worsen. For example, a tumor causing a partial blockage might eventually lead to a complete obstruction, causing severe pain and possibly requiring emergency intervention. Early detection of the cause of your discomfort can prevent such complications. Additionally, persistent abdominal discomfort can affect your quality of life. It can interfere with your daily activities, disrupt your sleep, and cause anxiety. Seeking medical advice early can help identify the underlying cause, whether it's colon cancer or another gastrointestinal issue, and lead to effective management and relief of symptoms. A feeling that your bowel doesn't empty completely. A feeling that your bowel doesn't empty completely after a bowel movement can be frustrating and worrying. This symptom, known as tenesmus, can be caused by various conditions, including a tumor in the colon obstructing the bowel. According to a journal article in Gastroenterology, tenesmus is experienced by about 15% of patients with colorectal cancer at the time of diagnosis. Colon cancer can cause a partial blockage, leading to a sensation that stool is still present in the rectum, even after a bowel movement. If you consistently feel that your bowel isn't emptying properly, it's a good idea to talk to a doctor. This feeling can also be accompanied by other symptoms like a change in stool size or shape, a sense of urgency to have a bowel movement, or discomfort during bowel movements. These symptoms can be indicative of a growth in the colon that is disrupting normal bowel function. Consistently feeling like your bowel isn't emptying properly can affect your quality of life. It can lead to anxiety and discomfort, making everyday activities more challenging. Seeking medical advice early can help determine if this symptom is related to colon cancer or another health issue and provide the right treatment. Your doctor can perform a physical examination and recommend diagnostic tests, such as a colonoscopy or imaging studies, to identify the cause of this sensation. Early detection and diagnosis are crucial for effective treatment, especially if the underlying cause is colon cancer. Ignoring this symptom can allow potential problems to worsen, possibly leading to more severe blockages or complications. Weakness or fatigue. Feeling extremely tired all the time, more than what's normal for you, can be a sign that something isn't right in your body. While it's common to feel tired after a long day or a bad night's sleep, excessive fatigue is different. This kind of tiredness doesn't go away with rest or sleep and might be a clue that your body is dealing with something like colon cancer. According to an article in Oncologist, fatigue is reported in approximately 80% of patients with colorectal cancer. Cancer can cause this deep level of tiredness because it takes a lot of energy from your body. Colon cancer, in particular, can lead to fatigue due to several factors. The cancer cells consume a significant amount of your body's energy supply, which can leave you feeling drained. Additionally, the disease can cause internal bleeding in the colon, leading to anemia, a condition where you have fewer red blood cells to carry oxygen throughout your body. Anemia can cause severe fatigue and weakness, making it difficult to perform everyday activities. If you're feeling this way, it's important to talk to a doctor who can help figure out why you're so tired by asking questions, doing tests, and checking your overall health. Persistent fatigue is your body's way of signaling that something may be wrong, and it's crucial to address this symptom early on. When you discuss your fatigue with your healthcare provider, they may recommend blood tests to check for anemia or other underlying conditions that might be causing your tiredness. Imaging tests or a colonoscopy might be suggested if there are other symptoms indicative of colon cancer. Persistent pain or discomfort in the abdomen. Feeling pain or discomfort that just doesn't seem to go away and you can't figure out why is something to take seriously. This kind of pain, especially if it's hanging around without an obvious cause, might be your body's way of signaling that something's not right. Colon cancer can cause abdominal pain by creating blockages or affecting how your intestines function. A tumor in the colon can obstruct the passage of stool and gas, leading to pain, cramping, or discomfort. This pain might be persistent and localized to a specific area of the abdomen, or it could be more generalized. Persistent abdominal pain is not just an inconvenience, it can be a crucial warning sign. Ignoring it might allow potential problems to worsen. For example, a tumor causing a partial blockage might eventually lead to a complete obstruction, which can be very painful and may require emergency medical attention. If this discomfort doesn't go away, it's essential to seek medical advice to determine the cause and get appropriate treatment. Your doctor can perform a physical examination and recommend diagnostic tests, such as imaging studies or a colonoscopy, to identify the source of the pain. Early detection and diagnosis are crucial for effective treatment, especially if the underlying cause is colon cancer. According to a study published in Clinical Gastroenterology and Hepatology, persistent abdominal pain is reported by approximately 30% of patients with colorectal cancer. In addition to colon cancer, persistent abdominal pain can be caused by a variety of other conditions, such as infections, inflammatory bowel disease, or diverticulitis. Regardless of the cause, it's important to address this symptom early to prevent further complications and improve your overall well-being. Chronic abdominal pain can significantly impact your quality of life, affecting your ability to perform daily activities and causing stress and anxiety. If you experience ongoing abdominal discomfort, keep a record of your symptoms, including their frequency, duration, and any associated factors like eating or bowel movements. This information can be invaluable for your healthcare provider in diagnosing the problem and developing an effective treatment plan. Thank you so much for watching. See you in the next video.